Rick, thanks for joining us.
My pleasure.
I wanted to continue to follow up. I'm trying to talk to some clinicians at the meeting just about, we talk so much about all these grand technologies that are becoming available and are being available to treat diseases. In between that process is the physician who has to communicate with the patient, who has to obviously prescribe the medicine, perform the procedure. And one area that you've got a acute focus on is glaucoma and MIGs, and that's been a space that we've talked about in a podcast that has grown exponentially, and you have so many more opportunities and options than you did before. Where are we? Let's back up with where are we with treatments for glaucoma? You've got quite a array of options now that you didn't have before. What is your practice like in terms of the options you're able to give to patients?
Well, I think that glaucoma has evolved dramatically. If you think about it, we spent a long time with the same medications, and there was some innovation on the diagnostic side, very little innovation on either the pharma side or the surgical device side. However, really the last few years, particularly the last 2 years, for example, it's been a dramatic change on the device side. Mm-hmm. So being able to offer patients a safer and effective way of controlling their pressure surgically has really changed our approach to disease. We used to put off treating it surgically. They had a lot of complications with standard classical trabeculectomy. All the MIGs options have changed that. Patients are more open to it, and doctors are more open to it, and I think that's why you're seeing the great success of Glaukos and the other companies that are developing the MIGs products.
What has MIGs specifically meant for your practice in terms of patients you're able to treat now, business you're able to generate?
Yeah, patients will specifically seek me out now because they know that we've been involved. We've been involved with MIGs, all the companies from the very beginning, and it's been a long battle, in some cases over 10 years, getting past the discovery phase and all the way through the regulatory approval. And so, patients like that. I had a patient, my practice in Northern California, I had a patient come down from Oregon just a week ago. Locally, she was told that she needed a trabeculectomy. When she went home to read about it, she really didn't like all the side effects and sought me out to have a procedure done, mm-hmm. Which was, she was so thrilled. In fact, we did the surgery on this last Monday. She gave me a huge hug the next day and was just thrilled by the whole process. Had good pressure control and none of those side effects that we worry about with trabeculectomy. So it's a wonderful thing.
And how about on the financial side of things? How have things played out with reimbursement with MIGs?
Yeah, well, and that's one of the big challenges. It's been a challenge, of course, to get regulatory approval.
Sure.
That took a long time for Glaukos, but the reimbursement side has been even tougher. And in my dream, I hope that in the future that someday that we'll be able to consolidate FDA approval with reimbursement so that both the insurance companies, Medicare, and all the payers will go along with what happens by the FDA. The fact now is that something gets approved, but we don't see a reimbursement piece in place for about a year.
Sure.
And it creates this pent-up demand where patients want it and they don't have coverage for it. So I have spoken to the FDA about this, and they recognize that we're not doing a service to the American public when we get approval, but we really can't use it because it's not a covered benefit. So I would hope that both the FDA and industry change the design of these to begin to show the value on a reimbursement side as well as approval.
So where do we go from here with MIGs? You were going to be leading a discussion this morning, sort of about the incorporation of MIGs with drug delivery with other functions. How is that movement progressing, and does that maybe provide a solution to the reimbursement problem if there's a drug administered with the the MIGs device, perhaps
Yeah.
reimbursement becomes
Well,
more likely.
underlying the whole issue here is a problem with any chronic disease, which is adherence and compliance with medications. And so there's been a big push over the past 5 to 10 years by a number of companies to develop drug delivery systems. Allergan has one, Ocular Therapeutics, MIGs Therapeutics, punctal plugs. There's a whole slew of different drug delivery systems in place. These delivery systems will deliver drug. But I think as you step back and look at what could happen and probably will happen in the next 5 or 10 years will be the merger of these MIGs devices that are surgically treating a specific part of the eye and a glaucoma drug that perhaps treat a different part of the eye. Perhaps it provides neuroprotection or neuroregeneration. So now we've got a directed treatment at the outflow system and a treatment on the posterior segment. And that, of course, is a bit of a pipe dream at the moment. But the introduction of all these MIGs devices has opened the opportunity up, and hopefully we have the wherewithal to go after it.
That's great. And so, I mean, as someone who's treated glaucoma for a very long time, I mean, this is a heyday for you, I imagine.
It's been an exciting time. I've been in glaucoma for 30 years, and we've struggled for so many with nothing new, and now we have a lot of interesting options, and we still have a long way to go. We still are lowering pressure when we need to protect the nerve. So I'm hoping that still in my career that we'll be able to treat both pressure and optic nerve at the same time.
Well, thanks for joining us today.
Thank you.